Well, thank you all for being here. Obviously, the events of yesterday are tragic and still fresh on our minds. So I wanted to take this opportunity to tell you what I can and kind of speak more broadly about a rough couple weeks that we've had here in our city and across the metro. So obviously, as you all are aware, I know there's lingering questions, and there will be for some time, as there are in any kinds of incidents like this. I cannot speak to and will not speak to the specifics of the investigation or any investigation broadly. But what I can tell you is that yesterday afternoon at approximately 1:43 hours, we were called to the 16,000 block of Larkspur Lane, the apartment complex there, the Opal Spring Apartments, regarding a domestic violence disturbance with a possible assault. When we arrived, officers encountered a female who ultimately was armed with a knife, and as a result of that encounter, it resulted in 2 fatalities, one to the armed female and one to a child. I'm not going to release any identities or any more identifying information as it pertains to that until notifications are made. All of that will come out as the investigation unfolds. As you can imagine, this is heartbreaking. I'm a father and a husband, and just like anything that would tragically affect a family, my heart goes out to that family that was absolutely torn apart yesterday. From our side in the Independence Police Department, it also affects our personnel. Obviously, there is an emotional and massive toll on our Independence family, our community, anytime we have incidents like this that occur. I can tell you that per normal protocols, the officer that fired, and there was one that fired, is on administrative leave. The other officers that initially responded are also on administrative leave at this time, which is normal protocol for us while the investigation plays out. I can also tell you that per their training, their response was exactly as they were trained to perform yesterday, and they did so according to that training and expertise. We have systems in place and incredible partners in this agency, within this community, that we rely on day in and day out to perform our duties, and we had that in place yesterday. There was one of our mental health co-responders that was on scene and actually responded to the scene to engage, and ultimately was not did not end up engaging before the situation escalated to where it ultimately resulted in those fatalities. What I'd like to focus on is a broader message, and while again the events of yesterday are tragic, there is something that we can do in situations like this, and we need the public's help. This affects not just Independence, not just the metro area, but all across the country. We are seeing large numbers of incidents where we have juveniles that are armed with guns that end in violence or accidents. We have people with substance abuse issues, mental health crises that end in violence or accidents, and we need help. Oftentimes in the public, these are family members, these are friends, these are neighbors. There are signs and signals that present themselves far before the police ever become involved. And what we are pleading for is those individuals, not to sound cliche, but when you see something, please say something. I know that that doesn't always turn out as expeditiously as all involved hope, but it is better than nothing. And when we all come together as a community and look out for one another, there's a higher likelihood that we can prevent things like this from ever happening. To aid in that endeavor, I'm going to show you a public service announcement that we have put out previously, and my hope is that you all can help us amplify that message across our community, which speaks to specifically incidents that we've experienced here in the past couple weeks being prevented in the future with a little bit more awareness and responsibility within our community. So we'll show that, and then I'll conclude and take some questions. Again, I know it's a small reminder, but anytime that we have firearms that are unsecured in residences, anytime that we have firearms in the hands of those that are prohibited and should not, there is a likelihood that tragedy can happen. Same goes for, again, those that are in substance abuse crises or mental health crises that end up with a weapon. Our goal is to prevent those or de-escalate those where we possibly can. And we need the community's help in that. So please, we're asking for that today, and we're asking all of you to help us get that message out. I will end, before I take questions, by saying I can tell you as a police officer, not only as the chief of police for this agency, but I know I speak for other officers across this community as well as our entire profession. No officer ever comes to work, whether it be from their first day to their last, expecting or wanting to take a life. Unfortunately, sometimes through the course of our duties and the things that we are called to, those split-second decisions are made, and that tragedy occurs. But I will tell you that there's a heavy burden that comes with that. We have a robust support system, and we will continue to care for those involved, and we will address those situations where we can. But I will tell you, as the chief of this department and the tragedies that we have incurred, there is only so much that we can take. We are all human beings, and just like any other wound, wounds will heal, but there will be scars. And so where we can do anything to try to get in front of and prevent these incidents from occurring, we are absolutely going to do. And with that, I'll take some questions.
Chief, I did want to ask you actually sort of a few questions. You mentioned that it was one officer that fired a gun, correct?
Correct.
I know you're not identifying that person, but if there's anything you can tell us about how long this individual has been on the force, whether this person had crisis intervention training, CIT. I know there's a 40-hour course that a lot of officers take. I don't know how many of your officers take that or not. And then the other thing, you mentioned it was a child, but we've been told by lots of people there it was an infant, a baby, maybe no more than a few months old. Can you confirm that information as well?
I cannot confirm any of that. I'm not going to identify or get into any sort of ages or anything like that. That will be as the investigation tolls. And most of that is just out of respect for the family and notifications. I know that the information is out there, and many of you have spoken to members of or supposed members of family. But I don't have that information as it's being investigated by the PIT team, which I'll go into that. I'm not going to give you any identifiers of the officer at this time, other than to say they are a long tenured veteran of law enforcement. And there was one officer that fired. However, there were multiple officers, as you all reported yesterday, that responded immediately to that scene, and all of them are affected, along with the fire department personnel, the AMR personnel that responded to that scene, our dispatchers that took the initial call and then monitored and coordinated that call for service, obviously the PIT investigators, anyone that had any sort of involvement in an incident like this is affected, obviously.
How many officers total are on leave?
3.
And that's including the one officer?
That is including the one, yes.
Okay, and so the two persons who passed away, what were their causes of death?
They were, I can't speak to their official causes of death, as that will come from that'll come from autopsy and confirmation as the investigation goes on. So I don't have that information. That'll come from the investigation as far as the PIT team. I will just tell you that as a result of that incident, 2 individuals are deceased, one being the female armed with the knife that I mentioned earlier, and a child.
Was there alleged child abuse before officers showed up?
I don't have any of that information.
What was the
Has the
baby shot by
family
police?
notified?
I don't have any of that information. Again, that will all come from the investigation. So you asked about the PIT. Hold on, let me explain that for you. You asked about the PIT team. So anytime since this was stood up, I believe we're going on 2 years now, just as an abundance of caution for both impartiality as well as neutrality, what we have is anytime there is a deadly use of force, such as this, we call in the Eastern Jackson County PIT team. That is made up of trained detectives, almost like a Metro Squad that you all are familiar with. It's the Eastern Jackson County side of that. Trained detectives specifically trained in officer-involved shootings, use of force, deadly use of force encounters. That call was made immediately. So you have the initial response from responding officers from our agency. They handle the initial triage of the scene and then lock it down just like we would do in any other scene. And then from the investigation side, those detectives from that team will respond to the scene and they take over the investigative efforts from there. No one from our investigative team. The lead agency is in Eastern Jackson County, so it's not one agency. The officer in charge is from Blue Springs Police Department.
Chief, often, like you say, you send this out to the PIT team. We often hear about these type of use of force.
Sure.
But we never really get the conclusion of the investigation. At what point does this team make this conclusion of these investigations public?
Yeah, so it's all subject to public record, just like anything else. So once the investigation is closed, just like if you think of the course of any other investigation, it's just the makeup of who does it for the impartiality. So the same process, there is no different. What they will do, they will process the scene like they did yesterday. They will collect records. They will conduct interviews as course of any normal investigation. They will then present a case file to the prosecutor's office, to the Jackson County Prosecutor's Office, and that will be reviewed, and then a charging decision is made just like any other case. So that will follow, and then once that is done and it is through whatever court process results, no different than any other case, at that point it becomes subject to the Sunshine Law and public record.
Why not be proactive and put it out in the public? You put out a press release yesterday about this. You put out a press release about the officers being shot at the day before. There was also a press release about the highway, the wrong way crash on the highway.
Correct.
Why not go public when these investigations are complete?
Because we don't want to jeopardize the investigation and where that leads. First
When
off,
it's completed,
yeah, I don't have any problem once it's completed coming back and having a press conference and we can discuss the events surrounding it. It won't happen until that is done. I don't have an issue with that, to go back and address that after the fact.
Have
Chief, I wanted to-
Have your office made previous calls to this apartment?
We have one prior call that I'm aware of. There could be more, but again, we haven't looked into any of that as we turned it over to the PIT team.
What was the
So
nature of that call?
I'd have to go back and look. I just know that there was one call prior.
Just to follow up on the whole
Go ahead.
CIT training thing, you mentioned that you had a mental health professional that was at the scene. What is the protocol there? Because it sounds like potentially the best case scenario would be for the mental health or somebody who's CIT trained to be able to de-escalate the situation before it gets to where this happened, but that didn't happen. It was the reverse of that. And again, how many of your officers have gone through that 40-hour training?
We have a majority, in fact, depending on the police academy that they attend, it's included in the academy. So they attend that 40-hour basic CIT program, depending on the academy. Not all academies do that, but we have a vast majority of our officers that are CIT trained. I will tell you, I will clarify what you said as far as it seems like the right call would be to de-escalate. And I would push back on that a little bit to say, in a normal static environment where there's not a weapon present, I would agree with that, and that's what we do. But I will also tell you that there were de-escalation attempts yesterday, and that involved two. But this is the co-responder that is here is a mental health professional that is embedded, one of two that are embedded with our police department from an outside mental health agency, and they are not trained nor armed individuals to encounter somebody that is armed. So that would not be. I'll get to you here in just a second. That would not be normal nor acceptable. Our job, obviously, we have a responsibility to protect them as well. So we try to do that as much as possible, but that also is situationally dependent. Go ahead.
The fact that you called this press conference because of all the violence against children recently, would you call this a crisis mode in this area?
I would say we're at an inflection point. Absolutely. I mean, and I know that that's not just here. that we are seeing, I can tell you, I don't have the empirical data to give you statistics, but I can tell you that over the past several years, we have seen a sharp rise in the amount of firearms that we are taking off the streets on normal, routine, ordinary calls. Oftentimes, you have firearms in the hands of people that are prohibited from encountering those. Sometimes it's just accidental firearms that are left out or accessible inside of a residence, and you have someone that results in a shooting, but of all ages, all spectrums. That's preventable. That's a preventable death. It's a preventable injury. And so where we can amplify that message of prevention and safe and responsible ownership, and you know, that's important.
What other instances prompted this call to action today?
We've had a couple. We had a death investigation on Chrysler. We had officers that, I mean, you mentioned several. We had officers that were shot at yesterday morning. We've had incidents where, again, we've taken off several recently. I mean, over 10, I can tell you. I don't know the exact number, but over 10 where we've had incidents where we've presented cases recently for felons in possession. It's no secret. I mean, it is on the rise.
Are you guys
and that
close
is-
to doing anything with that Chrysler one, the Ezekiel boy that was killed?
It's
Have it-
still
has
under
that-
investigation.
So there's nothing new on that?
Nothing new at this point. Still
Was
under
the child
investigation.
welfare notified after the earlier call?
We engaged DFS. Again, I know you want specifics on the other call. I have nothing for you. I haven't looked into that, but I will tell you, no, I'm just telling you that I can't speak to that specific call. What I'm telling you is it is normal for us on routine calls for service to hotline things where we suspect that there may be child abuse or danger to children. That's a normal procedure for us.
You mentioned you would identify the victims from yesterday. Have the
Correct.
family been notified?
We are working on those notifications. That is through the PIT program or PIT process. That's their piece of it. But I can't tell you whether or not today, whether they were. That will be them. That's not for me to
Were there any
release.
other arrests at the scene?
There were no arrests that were made at the scene.
So for the pit crew, or for the pit team, who's gonna come forward with those details? Is it still gonna be independents?
We'll have our PIO will reach out at the time that is appropriate for those notifications and identifications to be made, yes. So we will do that once they go. I'll take a couple more. Go ahead.
They had mentioned that, especially when acts of violence are affecting children, that they would like to see more of a mental health presence on scene. What is your goal to bring more people with that kind of training, especially when these incidents involve children?
That's a great question, and we try to do that. We do our level best. Here in Independence, I'm very proud of the efforts that we have, somewhat redundant sometimes in terms of overlapping. I mentioned the mental health co-responder. We talked about the CIT, the crisis intervention team training that our officers go through. Also in conjunction with that, we have social workers that are within our health department and our ARCH program through our fire department that is there, which has a community paramedic and social workers that are there that respond to people in crisis and other calls that we get that maybe more on the social work side, more so than either the law enforcement or the fire medical side. So we are out there engaging in those efforts each and every day. And we will continue to do that work, but it's tough. It's tough because you don't know what you're going to encounter when you get there, and it may change, as I'm sure you all have seen. Sometimes it starts with a conversation and escalates from there. Sometimes it's amped up when you get there and you're able to successfully de-escalate things and get people to services. Ultimately, we want people to be self-sufficient, responsible members of the community that are healthy and well taken care of, and we will continue to do that work and engage with our community partners to that end. Go ahead.
You said earlier that you wanted the public's help in reaching out to you all and letting you know about the signs and signals that people might see. Do you feel like you have adequate staffing and support to respond to all of those calls and notifications from the public that you are asking for?
I do. We have systems in place. There's always things like, and we have a broader network, as you all are well aware of. The TIPS hotline vets those tips when there's times for whether that's crimes that are going to occur or could occur or offenders, but there's multiple avenues for people to call. You have the standing up of the 988 suicide prevention hotline. There's other hotlines that are out there. The resources are there to utilize. We just need to be able to get that awareness out. Does that mean that we're going to be perfect and get everything right on the nose? No, not even remotely close sometimes. But one call that saves one life or gets somebody the treatment and the assistance that they need, well worth it.
I understand someone was
Go
sitting
ahead.
out in handcuffs.
Go ahead, ma'am. I've given you a lot. I'm trying to go. So, go ahead.
Okay, so the initial call that you got, were there any reports to injuries of anyone in the home that you were responding to in this domestic violence situation?
Ask that one more time.
The initial call that you got for response for the domestic violence situation, were there
Yep.
reports of any injuries to anyone in the apartment when you all first responded?
There was reports of an assault or an alleged assault. I don't know about injuries. Nothing that I'm aware of that indicates specific injuries or, possibility of injuries. That will all be part of the investigation. I know you all have lingering questions about who, what, when, where, why, and how, and I get that. I really do. That will be stuff that we don't have access to as they dig in. Part of that is historical to start from how did this happen, what happened, and then what happened after, and putting those pieces together. I just don't have those answers for you as we stand here today. I'll take two more.
Can
Yes.
you tell us who called police to the scene, and was there a third individual in the apartment? Because I think what we're all trying to understand is, was the child injured before police arrived?
And again, I
Did
don't.
somebody call about that, and who made the 911 call?
I don't have any specific information to give you as far as that piece of it. I will tell you that it was a third-party caller that called into 911, but I don't know where they were as far as the
You know what they
relation.
reported, or-
Just that, a possible alleged assault, domestic violence assault, which is how the call was classified.
Chief, I wanted to ask you. about
Last
this
one, Andy, go ahead.
Specific officer, we've talked about CIT training. Do you know if that particular officer had CIT training? And it sounds like, based on what we've heard, that this infant died from gunfire from this officer. That's what we're hearing. I don't know if that's true or not, but is there any different protocol about whether you use a firearm, even if somebody's got a knife and there's a child present?
The protocol remains the same regardless of who's present. It's no different than what the law requires, which is if there is imminent threat of death or serious bodily injury to anyone else or themselves, that is an evaluation factor. So as far as the information, as far as that officer receiving CIT training, I don't have that for you at this time. But I will just tell you again to reiterate that we are avid partners in that process, believers in that program, and we work to that. In fact, and we've seen that work so much so that again, these police academies, where 10 years ago that was not part of the curriculum. It was a separate course that you went through for 80 hours, and then the advanced and subsequent CIT training that's available has now is making its way into that basic training set of curriculum. So it is important.